Yukazo. Today we're going to be going over the MDI competency. So the first thing we're going to do is review the physician's order for the drug, the dose, and the route, and other pertinent information to this treatment. So we're going to be doing a unit dose of albuterol in this treatment. We're also going to review the patient's chart for any pertinent information, for any allergies, for any contact isolation or requirements, any other information that may regard us and the patient. After that, we're going to go ahead and gather our supplies. So for this, I want my pulse oximeter, my stethoscope, disinfecting wipes for my stethoscope. I have my gloves and PPE. I have my holding chamber, my spacer. I have my incentive spirometer for the test, my calculator to do the calculations. I have pen and paper, my paper flow sheet to record with nothing on it besides my name as the respiratory therapist, as well as my hand sanitizer. I also have a napkin for the patient to cough into after their treatment. So I'm gonna go ahead and sanitize my hands for 15 seconds or more as I enter the patient's room. So I'm gonna enter the patient's room. Hello, my name is Nolan Yukazo. I'm a respiratory therapy student with Hartnell College. How are you doing today?
I'm good.
What is your name?
Neftali Lazaro.
Neftali Lazaro. And your birthday?
10/6/92.
Okay, may I confirm that with your wristband? Okay, perfect. So I'm going to confirm the patient with two identifiers, first and last name, as well as date of birth. After that, I'm going to go ahead and explain the procedure and gain consent. So today we're going to be doing a albuterol treatment for your asthma exacerbation. With that, have you had albuterol before?
No.
No, you have not. Okay. So there's a couple of side effects. It can cause increased heart rate, shakiness, dizziness, dry mouth. If at any time when you experience those during the administration, the treatment, let me know and we'll go ahead and stop immediately, okay?
Okay.
So is that all right with you? You understand the procedure? Any questions?
No, I understand. Yeah.
Okay. So we're going to be doing it through the immediate dose inhaler, and we'll walk through that in just a second.
Okay.
So I have now explained the procedure, some of the side effects, and I've gained consent. If there's any family members in the room, which there are not, we can go ahead and gain their consent as well, or their understanding, see if they have any questions. So after that, we're going to go ahead, we're going to apply gloves, and we're going to begin taking vitals. So I'm going to apply the pulse oximeter into your finger, okay? And it's going to measure the amount of oxygen you have in your blood as well as your pulse.
Okay.
You're going to do this a couple times throughout the treatment. Point your finger out. Perfect, thank you. I'm going to go ahead and take your pulse. And I would be taking your pulse for a minute, okay?
Okay.
So I'm going to tell her a minute. I'm going to take it for 30 seconds and then take her respirations for 30 seconds as well. I'm not going to let her know about the respirations so she doesn't consciously change them. So my beats per minute are going to be 32, and I'm going to multiply that by 2. Respirations are 10, so it's going to be 20 respirations a minute. I'm going to go ahead and note this. Pre-heart rate is 64, respirations are 20. Where SpO2 is 98%. Okay, and skin signs right now, good, no cyanosis, warm to the touch. Okay, I'm gonna go ahead and take this off for right now. So good skin signs. Are you having any trouble breathing right now?
A little bit.
Okay, from 0 to 10, can you rate that? 0 being nothing, 10 being extreme shortness of breath, and 5 being in the middle?
6.
A 6, okay. So 6, that's our assessment of dyspnea, or trouble breathing. I'm going to go ahead and take a couple lung sounds for you, okay? I'm going to start on the back and do 8 on the back, 8 on the front, and then 2 on each side, 1 on your throat as well. Is that all right? So I would be doing the bell of the stethoscope to skin. Go ahead and take a nice inhalation through your mouth. Thank you. Very nice, thank you. I'm going to move on to your sides now. If you feel lightheaded at any time, let me know, okay?
Okay.
Mid-axillary line, go ahead. up closer to your armpits, they'll move auxiliary. Thank you. Thank you very much. Okay, so we're gonna do the same thing on the front, okay?
Okay.
Go from the top now. Okay, thank you. Last one's gonna be right over your throat, okay?
Okay.
Okay, thank you very much. So noting any abnormal adventitious sounds, inspiratory and expiratory wheezing on the lower right and left lobes, posterior and anterior. So I'm gonna make note of that. Right lower lobe is wheezing on inspiration. And then left lower lobe is wheezing as well. That is most likely due to the asthma exacerbation. Okay, so at this point we're gonna go ahead and test your ability to exhale air in a forced expiratory volume. So it's gonna be over a short period of time, okay? So we're gonna do this, we're gonna take 3 results, the best of 3, and we're gonna compare that to your percent predicted. After reviewing your chart with your age and height, we're predicting that you're gonna be blowing around 418, okay?
Okay.
So we're gonna write down the predicted 418. So when we do this, we're gonna wanna sit upright, feet on the ground, good posture, shoulders back. We're gonna take a nice deep breath in and forcefully exhale through this hole, okay, lips pursed around. And we're going to mark with the green 418. The best of 3 results we'll take, and then we'll compare that for your percent, or your percent. Go ahead and blow. We're gonna do 3 results. Okay. 210. Noting patient effort as well, so good effort right now. Thank you. 190. And 210 again. So I'm gonna hold on to this for just a second. 210 being the highest. So we're gonna take 210 divided by 418 times 100 to get your percent. Okay, so we're about at 50% of your predicted. Okay, so we're gonna go ahead and do the treatment, and we'll note improvement from there as well as your baseline vitals.
Okay.
So this is our albuterol. This is gonna be the treatment that we're giving. So this is our albuterol in here. We're gonna wanna warm it up and shake it since it hasn't been used in a little bit. It's a fresh dose. This is your actuator. So we're gonna uncap it, and then we'll go through the setup and the administration process, okay? So we're gonna place this inside after it's warmed and shaken. And we're gonna shake it a little bit more, and then we're going to prime it. So give it a quick squirt just to get any of the particles moving, help it get off the bottom and unsettle it. So with our albuterol, we're gonna use a spacer or a holding chair. This is gonna help reduce the need for as much coordination, okay? So we're gonna plug it in like that. We're gonna uncap the mouthpiece. When we go ahead to inhale this, we're going to want to press the trigger, the actuator, at the same time that we're breathing in, okay? So we're gonna sit upright, head slightly back, and hold the mouthpiece in our teeth. So lightly gent the tip of it, as well as pursing our lips over the top so that it deposits into our throat and lungs and not onto our teeth. So we're gonna hold it in our mouth, take a big exhale out, and then hold it. Long inhale, we want a slow, long inhale. We're gonna stop, we're gonna wanna hold for 4 to 10 seconds, 10 being the best, okay? Just to make sure everything deposits in our lungs. And then we're going to slowly exhale through our nose if possible, making sure that anything that's still in suspension in our airways can then deposit and we don't blow it out immediately. Do you have any questions about that?
No.
Okay. Would you mind setting it up for me and kind of walking me through the process before we take it to confirm your understanding?
Okay, so I'm gonna put this here, and then I wanna press it, and then I'm gonna inhale out, and then inhale in, and then I'm gonna hold it. I want a deep, slow breath. I'm gonna hold it for 4 to 10 seconds, and then gonna exhale.
Okay. And if at any time during this you feel any of those side effects that we talked about, we can go ahead and let me know, and we'll discontinue it immediately, okay?
Okay.
Okay, whenever you're ready.
Okay, so I'm pressing it.
Okay, very nice, good job. Go ahead and take this from you. I'm going to disconnect it. We'll go ahead and clean this afterwards. If you were to need another dose, a second dose of it, we're going to wait about 1 minute, okay, for the second dose. So now, after a minute or two goes by, I'm going to go ahead and have you cough into this, okay?
Okay.
I'm going to note any sputum production, color, odor, consistency, and amount. Okay, good job. No sputum produced. So I'm going to go ahead and write that down. Good cough. And then no sputum. Okay, after this, I'm going to go ahead and reassess your vital signs, okay? Okay, so we're going to let that go. I'm going to go ahead and take your pulse for a minute. Okay, so this is just albuterol as well, but if it were to be a corticosteroid or anything, we can go ahead and have the patient rinse their mouth to avoid any thrush or infections, but it is not. So again, we're going to be doing the 1 minute of your pulse. Okay, so we're going to do 30 seconds of pulse, 30 seconds of respiration, not inform the patient so that they don't alter it consciously. So we are at 8 respirations a minute and a pulse of 30. Okay, thank you very much. I'm gonna go ahead and check this. We're at 98% as well. So I'm gonna leave that on you for just a second while I write this down. Heart rate of 30, so 60 heart rate when it's multiplied by 2, as well as 16 respirations a minute. Okay, are you having any trouble breathing right now from that scale from 0 to 10? 0 being nothing, 10 being extreme. Are you in any shortness of breath?
About a 1.
Okay, about a 1. So that's good improvement. 1 dyspnea. Okay, so I'm also noting, I'm going to take this off you. I'm also noting the color and temperature of your skin. So you're warm to touch. Good color in your skin signs, so no signs of cyanosis. 1 on level of breathing. So I'm going to go ahead and took the saturation, pulse, and respiration rate. I'm going to go ahead and assess lung sounds, okay?
Okay.
So I'm going to start at the back again. I'm going to do 4 on the back, 4 on the front, and then 2 on the sides as well, 1 over your throat. Nice deep breath. Good. Good. Okay, good job. I'm going to take these on your side, in the mid-axillary line. Okay. This one closer to your armpit, mid-axillary line. Thank you. Okay, thank you very much. For the front, we're going to do the same thing. Okay. Nice. Thank you. Thank you. We're going to have to go to the top of your gown. Okay. Thank you. Okay, thank you very much. And one last one over your throat, okay? Perfect, thank you very much. So clear breath sounds in all lobes and segments. The wheezing in the lower lobes has now diminished due to the albuterol, so that's a good sign. Go ahead and go to this. Clear breath sounds. Okay, so we're gonna go ahead and do the peak flow one more time, okay? We're gonna do it actually 3 more times. We're gonna take the best result and then we're gonna compare those two. We wanted to see a % change. So same thing, big inhale, and then exhale it. We're still targeting 418, okay?
Okay.
Good job, and great patient effort too. So we are at 400 exactly. Reset that, back view. We are at 430. We're at 420 for that. Great patient effort, by the way. Good job. How are you feeling right now?
I feel good.
Okay. So we're gonna take the 430, that was the best measurement we got, divide that by the 418, and then multiply by 100. Do the calculation real fast. Divided by 418. Alrighty, so we're at 102% compared to your predicted. And we're going to take the, it's going to be post minus pre over pre. So it's going to be 430 minus 210 over 210. So 220 divided by 210 equals 1. So it's going to be 1.04 times 100. So we're at 104% improvement from your first one. So good job. That means the albuterol is working very well. And you said you're feeling better too?
Yeah.
Okay, and no wheezing on breath sounds. So now that we're done with this, we're going to go ahead and clean our equipment, okay?
Okay.
So for this, we're going to want to rinse with warm soapy water. We're going to take the albuterol out. And we could rinse all our equipment with warm soapy water. We're gonna leave the air dry. We don't wanna clean, especially the spacer, with any paper towel or napkin to create static. The static will hold particles inside the chamber and create a film on the inside of the wall. So we're gonna leave all that to air dry. Afterwards, we can go ahead and make a bag with your name on it to keep it in your room for future treatments or when you take home.
Okay.
I'm gonna go ahead and disinfect this. I'm gonna go ahead and, can I help you with anything else today?
No.
Okay. I'm gonna go ahead and chart all my data right now. I'm gonna report to the physician and the nurse any pertinent findings or information. I can talk to the physician about the patient's care plan moving forward, as well as charting all the information for others. Okay, thank you very much today for the treatment, for the being a good patient. I would go ahead and gather my supplies, tidy up the room, and place the patient back to where they need. I'm going to wash my hands as I leave, dispose my gloves, and exit the patient's room.